So Pat McCarthy, like I mentioned, is a prevention consultant at our Kenilworth office. He recently graduated from Rutgers with a degree in social work and has a passion for helping others. Today, he will be providing us with a presentation called I'm Not Lazy, I Swear, and it dives into what executive dysfunction and choice paralysis are, its symptoms, care and treatment options, and where to seek help. And now I will pass it along to Patrick to give his presentation.
Can everybody hear me?
Yes.
Okay, cool. Okay, yeah, and I got it all set up now, so I can see my notes too. So that's good. One moment, 1 second. Okay, so can anybody here relate to getting easily distracted, daydreaming or spacing out, and difficulty finishing a task?
Yes.
Okay, cool. Sorry, it's a little bit laggy, so it's like I can hear myself in the other room talking, and then the voice is coming a little bit. All right, so the reason I bring these up is these are all symptoms of executive dysfunction. So what is executive dysfunction? The definition of it from Cleveland Clinic is a behavioral symptom that disrupts a person's ability to manage their own thoughts, emotions, and actions. So in simpler terms, it's when a person feels like it's impossible to keep attention on a task. No matter how hard the person tries to focus or concentrate, they cannot. And it's even just on one small thing. So this person may do something different instead of the task. You know, say that person is me and I'm working, they may be going on their phone, or they may be doing a different work task because they're just having the ability that they're just really struggling with finishing that task. So next we're going to talk about what this executive dysfunction disrupts and what it affects. So high level executive functions include planning, reasoning, and problem solving. So planning is deciding what to do, when to do it, how to do it, and who should do it. Reasoning is the process of forming conclusions, judgments, or inferences from factors or premises. And problem solving is the process of defining a problem, identifying its root cause, prioritizing and selecting potential solutions, and implementing those chosen solutions. So this is what the executive dysfunction is affecting in your brain and what you're thinking and things like that. So common causes of executive dysfunction: addictions, drugs and alcohol, autism spectrum disorder, obsessive compulsive disorder, schizophrenia, depression, and ADHD. So you may look at this and say, I don't have any of those, or maybe I have one of those, or maybe I have a couple of those. The reason I bring this up is just if you have more than one of these or a couple of these, you're at higher risk for executive dysfunction. But even if you don't have any of these, you could still get executive dysfunction, and we're going to talk about that in a little bit in a couple different slides about different things like that. So next, we're just going to talk about brain damage and executive dysfunction. So this is another way that you can experience executive dysfunction, or you can be more at risk for it. So brain tumors, cancerous or non-cancerous. I'm just going to run through the definitions of everything because we may see words like this and we may have an idea of what they are, but not know exactly what they are. I know for me, there's a couple things on this slide that when I was researching it, I was like, oh, I know what that is, but I'm not really sure how it would be affected. So brain tumors, not cancerous or non-cancerous. A brain tumor is a growth of cells in the brain or near it, and they can happen in the brain tissues, the glands, the nerves, and the membranes, or even just cover the surface of the brain. Dementia or frontotemporal dementia. So a lot of the time when we hear this, we think of older people. As you get older, you start to forget things. This can actually be an issue within people who are even younger. We've heard of if anybody's heard of early onset dementia, that can happen with people that are a little bit younger or maybe in their the beginning to late stages of the end of their life as well. So dementia is just the loss of cognitive function, thinking, remembering, and reasoning. So like we said before, we were talking about problem solving, reasoning, and planning was what executive dysfunction affects. So these are some of the main things that happen in dementia as well, which makes you more at risk for it. Next is epilepsy and seizures. So epilepsy is a disorder in the brain characterized by repeated seizures, and seizures is a burst of uncontrolled electrical activity between the brain cells, and it causes abnormalities in muscle movement, behaviors, and sensations, as well as states of awareness. And effects of seizures can be stiffness in the body, twitching, or limpness within the body. Concussions or traumatic brain injury. So this is a large one because anything that has damage to the brain, it's going to affect different thinking patterns. It's going to affect different parts of the brain and things like that. So concussion, it's usually a blow to the head, and it can cause issues with concentration, memory, balance, headaches. That's short term, but it can also be long term. And then traumatic brain injuries happen when a sudden external physical assault damages the brain. And it is actually one of the most common causes of disability and death in adults. Next is Huntington's disease. And Huntington's disease is a rare inherited disease that causes the progressive breakdown of degeneration of nerve cells in the brain. And then the last one is cerebral hypoxia, which occurs when there's not enough oxygen getting to the brain. So this is what brain damage and executive dysfunction is. This can cause you to be more at risk for executive dysfunction. You may not immediately have it. So if you have epilepsy and seizures, or if you have Huntington's disease or concussions, you may not even have executive dysfunction, but these do cause you to be at higher risk for it. Now, how is executive dysfunction treated? Current treatment runs through a couple different things. So we have medication, stimulants, antidepressants, and antipsychotics. So I always say you shouldn't be taking these, and this is just a general rule, you shouldn't be taking these unless it's prescribed by a healthcare professional, a doctor, a psychiatrist, a psychologist, a primary health physician. And then also, if you are taking these, you should not stop taking them unless you speak with somebody. This is to be safe. And this is for the safety of yourself as well as the safety of others. So psychotherapy, mental health therapy, cognitive behavioral therapy, that's a big one. I'm sure all of us have heard of it, CBT. And also a combination of a couple different things. It could be CBT, it could be therapy, and it could be medication. So psychotherapy, it aims to help a person identify and change troubling emotions, thoughts, and behaviors. And lastly, occupational therapy. So it's a form of therapy that helps those who are recuperating from physical and mental disorders or mental illness. And it just encourages rehabilitation through different activities that help you with daily life. So examples could be breaking tasks into smaller groups, writing note cards to help with memory issues, and then also making lists of tasks. And these are just a couple things. These are a couple of things of advice that you could get from people who are in occupational therapy. Just a way for you, like I said, make daily life easier and to help you if you have executive dysfunction, just to make things run a little bit smoother. So ways to prevent executive dysfunction. Wearing safety equipment, whether that's wearing a helmet, wearing gloves if you're working with anything that may be toxic or a toxic chemical, something dangerous, wearing a mask if you're going to be around chemicals, anything that could really affect the brain. So those toxic chemicals, if you're inhaling them, it could affect you. If you get something in your eye, it could affect your brain. And wearing a helmet when you're riding a bike or doing anything that could cause damage to the brain. Next would be preventing infection. So if you have like an eye or an ear infection, obviously the eyes and the ears are close to the brain. If it left untreated, the worst case scenario could be death. Of course, that's more in an extreme case, but it's just, preventing it, making sure that that you're, being aware if you're around somebody who's sick. And then if you do become sick, seeking help from a doctor and not just, letting it ride out. It's just better to treat these immediately instead of just waiting for them to become worse and cause issues. Balance healthy weight and diet. So circulatory and heart health is extremely important. Stroke can lead to issues in the brain. It can cause, function to be taken away. So just making sure that you're eating healthy, that you're exercising regularly, and even talking to your primary healthcare physician about this and asking, what are ways that I can avoid this? Making an exercise routine that works well for you. Maybe you don't like going to the gym. What else can I do? Maybe I can go for walks. Finding something that works for you, just so you can live a healthy lifestyle, making sure that you're eating well. These are all ways to prevent executive dysfunction. And lastly, having carbon monoxide detectors in your house, in your office. As we know, inhaling smoke from a fire is not good for you. So making sure that you have them in your house so that if something does happen, you can make sure to get out of the house, making sure to change your batteries every single time, every year or month, or however it works for you, just to make sure that you're being aware of your surroundings and that you're making sure that you're protected and that you're safe in your house. So where to seek outside help? Talking to your doctor or your healthcare provider is extremely important. Making sure they're aware of everything that goes on with you, making sure that you're honest with them. And if you feel you're having these symptoms of executive dysfunction, talking to them about it. What treatment can I get from it? And then that goes into our next. What are your treatment recommendations? Medication, therapy, occupational therapy. If there's anything else, this is just the presentation that I've created. I'm not a doctor, so I don't know if there's anything else outside of what I have found, and I'm sure there is. So finding out what works for you. Now, next we're gonna hop into choice paralysis. So I'm just gonna run through, do you ever feel like you struggle with making a decision, or you question yourself, or you doubt yourself? These are all symptoms of choice paralysis. So anybody here, raise your hand or say, yeah, I actually can relate to this, just so we get a little bit of engagement. So yeah, can everybody relate to this? I know I can.
Yes.
Yeah, so it's a pretty common thing. So like I said before, this isn't a diagnosis presentation. Just because you may see these things or you may feel these things doesn't mean that you have choice paralysis, doesn't mean you have executive dysfunction. This is just a way for me to show you to be aware of what's going on around you. And if you, like I said, if you feel you have this, go ahead and talk to your healthcare provider or a doctor or a psychiatrist. So what is choice paralysis? It causes you to have an intense emotional reaction when facing a decision. So feeling like almost like your life almost depends on the decision sometimes can be a part of it. Or, I'm so anxious, I can't even choose a restaurant to go to tonight, and just being so anxious, feeling like anxiety, intense, overwhelming from that decision. So we're just going to run through a small activity before we head into the facts. So usually when I do these activities, it's in person. So it would be a worksheet, and it would have a list of different statements with strongly agree, neutral, disagree, and strongly disagree. But since we're over webinar and I can't do that, I kind of tweaked a little bit. So it's more of just, I'm just going to read these terms out. If you can relate to them, say yes. If you don't relate to them, you can leave it blank. If you don't feel comfortable answering, you don't need to answer. It's just a way for me to engage and show you guys some of the symptoms and different ideas and thought processes of people who may struggle from choice paralysis. So just gonna run through this quickly. I constantly seek more information. Anybody relate to that?
Okay.
All right, cool. It's a little delayed, so I may not hear you if I start reading again. I have an intense fear of making the wrong decision. All right. I worry excessively about potential negative outcomes.
Yep.
I tend to miss or postpone deadlines due to inability to make a choice. For me, I relate to this one. I often feel stress, anxiety, or a sense of being overwhelmed.
Yes.
I continually delay making decisions by seeking more time to think or analyze the situation. I experience headaches and or digestive or sleep issues from decision making. So like being up all night, not being able to eat, constantly having a headache from this decision making. All right, that's probably a good thing that nobody said yes to that. I experience changes in mood or anxiety from decision making.
No.
And lastly, I have an intense fear of making the wrong decision. Okay, so if you answered some of those, doesn't mean that you have it. It's just an idea to have. A lot of these things, a lot of us feel. I know that I related to a ton of these, and one of the reasons that I chose to do this presentation was because I felt a lot of the things I related to myself. But like I said again, not a diagnosis here. So does anybody here have an example of choice paralysis in their own life? Or, maybe somebody else, you feel they may have it. When I ran through this presentation earlier, Zoe was like telling me about someone that she used to work with that may have experienced this in their own life. So just kind of curious if you guys have felt it, and it doesn't have to be like an intense, overwhelming issue with choice. It could even just be something as small as like I couldn't even choose a restaurant to go to, so I made somebody else choose.
Yeah.
I think when I had to choose on my first place, my first apartment, I think that was like really, because I'm like, if I do this one, X, Y, and Z pros and cons. If I go with this one, X, Y, and Z pros and cons. And that was really, really stressful for me. So that was a big one.
Thank you for sharing that. Anybody else?
Well, definitely. I mean, I wouldn't say it's me per se, but my girlfriend, she has a trouble of definitely picking where to eat. I tell her, I'm like, you decide, because sometimes I don't have the problem. She has the problem where she likes to go eat. So she's like, why don't you just decide? I'm like, it's better if you decide, because I know like in the long run, you'll be more happy if it was your own decision. And then she just picks.
I feel like that's a big one for a lot of people, choosing somewhere to eat, choosing somewhere to go out to eat. For me, I have a lot of issues with my allergies, so eating out of places is tough, so making a decision can be tough too. I'm gonna take one more answer. Anybody else have another example?
I feel like something that's common in our generation is always thinking that like the grass is greener on the other side, or maybe just like humans in general. So this in particular with like romantic relationships or even platonic relationships, you think, okay, I'm in this relationship. What if there's more? What if I stay? What if I leave? And that kind of like tug of war when it comes to letting people in your life, I think can be very difficult with people because we're so exposed to so many different types of people on the internet.
Absolutely. Completely agree with that. I never thought about that perspective. That was good. For me, my example, my own personal example would be choosing like a career. Prior to this, I graduated with a degree in social work. Up until about a couple months before graduating, I thought it's what I wanted to do. And I had an experience at an internship that made me feel a little bit like I was burnt out, like I wanted to try something else. And then I went and I tried something else and I didn't like it. And then I was like, oh, I don't know if I can return to, social work. I don't know if it's right for me. I mean, I already tried it. And just being like so anxious over the decision, feeling like I was planning my entire life out with just one decision. And then I just came down to it. This is what I want to do right now. I could always change it in the future if I need to, but for right now, this is what I want to do. And I feel like a good practice, just own personal practice for me, is just staying in the present. The past is the past. There's nothing I can do about it. And, the future, I have no idea what's going to happen and I have no control over it. So just trying to stay in that mindset has really, really helped me on my own personal level. And this isn't professional advice. This isn't something that I pulled from the internet. This is just, raw, my own advice. So tips for overcoming choice paralysis: simplifying small decisions. So one of these, like I said, picking a restaurant to go to, and maybe even just setting a timer for it. So if you really struggle with making decisions, spending so much time on it, set a timer when you're trying to, pick a restaurant, when you're going food shopping, choosing from one thing to the next, 5-minute timer, putting together an outfit in the morning. I know for me, sometimes I'll spend 30 minutes to an hour trying to figure out what I'm going to wear out to somewhere because I get so in my head about it. So just setting a timer and just choosing, it's not the end of the world though, because if the timer goes over, it's not the end of the world, but it also helps you isolate these decisions that you're making and just make it's a small decision. Food shopping, that stuff. The bigger decisions, like I said, the career stuff, it's a little bit more complicated, but, picking a restaurant to go to, going food shopping, your coffee order at a cafe, and just practicing that on a daily basis if this is something that you struggle with. Reassure yourself with, one second, sorry, I have a little issue there. Reassuring yourself with big decisions. So approaching these situations with a reassuring attitude towards yourself, going in positive, being like, I can do this, try not to create negative things. I can never make decisions. Having that attitude, it's not going to get you anywhere. And if you start to feel overwhelmed with a decision, just take a deep breath, take a step back, or even ask somebody else, hey, can you look at this for me? Do you have any, feedback or advice for me? Because I don't know how to deal with this myself. And, just realizing it's not impossible to make these decisions. In the end, you're going to be able to make it. It may take a little bit longer if it's a bigger decision. It may take longer if it's a small decision. It's not the end of the world. And a big thing for me is remembering the times in my life when I made those big decisions. I was able to do it, so if I go in thinking that I can't do it, that's not true. I've been able to do it before. And how did I get through that? How did I do that? How did I make those decisions? And then don't overconsult your options. Avoid entering a situation where there's going to be a ton of information getting thrown at you, especially if that's something that you struggle with. If you figure out, diversifying this thing from the next thing, it can really help to just avoid that situation altogether. Because, when you start considering these different scenarios and options, it may make you feel immobilized, and that's something we want to avoid. And then asking for advice from different resources to guide you, to make your mind a little bit clearer as well. Whether that's, a breathing activity or a meditation, a quick meditation, or if you're spiritual or religious, maybe saying a prayer, something to keep your mind at ease. There's so many different ways to help with that, and just finding out what works for you. Finding peace with uncertainty, that also falls into, not being able to control everything. So uncertainty, it's a part of life. We all have to deal with it. And just dealing with the best you can, and trying not to let uncertainty affect you is going to also help you not have to deal with that stress that comes along with it. And then just taking a break and deciding to breathe. Like I said, taking a step back. This is probably my favorite one, because sometimes I get so caught up in it. I'm like, oh my gosh, if I don't make this decision right away, if I don't do this right away, or if I don't do this by the end of the day, I'm going to be so stressed. I'm going to be so anxious. Sometimes you could just step away and, like I said, ask somebody else to look at it for you. Or, maybe if you step away and do a different task for a second, and then take your mind off of it for a second, maybe go for a walk, like I said, guided meditation, gentle exercise. One of the sayings that I like to say is move a muscle, change a thought. These are all ways to help you overcome that choice paralysis and kind of look at it, be like, this isn't as bad as I thought it was. So where do I seek help for choice paralysis? I've said it a bunch of times already: healthcare provider, your primary care physician, your psychologist, your psychiatrist, your therapist. These are all different resources. For me, these are the people that are professional. They're there to help. They're trained in this stuff. And if they don't have the answer, I'm sure they know someone who does have the answer. They're trained to help you and assist you in your physical and your mental well-being. They will be able to give you different treatment options that work best for you, whether it's medication therapy, occupational therapy, or even something else. Because, like I said, I'm not a professional. This is the information that I found, but there's definitely going to be more things for you. I think